I'm Lindsay. I live in Connecticut and I have two really great kids. They are ages 8 and 6. After I received the diagnosis of my pituitary tumor, I was really scared. It was not a small tumor. It was about the size of a ping pong ball. The tumor was pressing against my carotid arteries and starting to put pressure on my optic nerves. At first, I thought my glasses were smudged when I was driving, and then one day I was wearing contacts and I realized I was still seeing the same smudge. So I went to an eye doctor and they could not figure it out. They ran every test they could. There was really no question of whether or not I needed surgery. I want to see my kids grow up, they're my world. So that was too sad to think about. If I had a chance of stopping the vision loss, I wanted to.
This surgery was a team effort. It required the participation and collaboration of my ENT colleague, Dr. Frank Dellacono, and endocrinologists who are involved in Lindsay's care.
Lindsay's diagnosis was a pituitary tumor, a large pituitary tumor that was pushing on her optic chiasm, causing some visual deficits. It is also accessible behind the sphenoid sinus, which is a typical sinus where ENT surgeons operate.
To remove Lindsay's tumor, I had to utilize minimally invasive keyhole techniques, specifically using an endoscope so that we can visualize important structures around the tumor and to allow an easier and faster recovery. At Lawrence Memorial Hospital, we have Yale physicians who are experts at these minimally invasive techniques who can collaborate with our community partners and develop this type of team approach.
Patients don't have to travel to other places. We are able to do the job we need to do here to help the patients in this community.
I'm very happy with Lindsay's surgical outcome because after the tumor was removed, she does not have to be afraid of losing her vision so that she can continue to provide care to her lovely children.
I really appreciated the collaboration between my doctors, so Dr. Yeung and Dr. Dellacono, coming from a neurosurgery standpoint and an ENT standpoint because of the nature of the surgery, and knowing that they were both working as a team throughout the entire procedure made me feel like I was in excellent care, in excellent hands. It feels great to be across the finish line. Just knowing that we put the pause button, like we've stopped the degeneration, it felt good. I felt good. If there's no other reason for my family and I to have had to move to Connecticut, this was the reason. Being able to be here and to have had this successful operation and the second chance at a healthy life is 100% worth it.